All right, let's talk about something that can be, well, pretty scary. The term tumor marker. Just hearing those two words can make your heart skip a beat because we instantly think the worst. But what if I told you that name is one of the most misleading things in all of medicine? Well, in this explainer, we're going to pull back the curtain and get to the real truth.
So, picture this. You get some routine lab work done. You're scrolling through the results, and you see a number that's flagged as high. And right next to it, you see the words tumor marker. Your stomach just drops. And there's really only one question that floods your mind. Oh my gosh, do I have cancer?
And here's the answer, and it might honestly shock you. That answer is almost always a hard no. An elevated tumor marker, all by itself, is almost never a cancer diagnosis. In fact, for a doctor to rely on just that one number would be a huge mistake. So, what is really going on?
Well, the whole problem really starts with the name. Calling it a tumor marker sets up this expectation in our minds that just doesn't line up with what the test actually does. We've got to completely rethink what these things are.
Okay, let's get the official textbook definition out of the way. A tumor marker is just a substance, usually a protein, that we can measure in your body. And yes, it can be produced by cancer cells. But, and this is the most important, but it can also be produced by perfectly healthy cells or go up because of totally benign, non-cancerous issues.
And this right here? This is the most important mental shift we need to make. We have to stop seeing these markers as proof of anything. Instead, we need to start seeing them as clues. That's all they are. They're just little biochemical signals, one tiny piece of a much, much bigger puzzle. They are never the whole picture.
I love this analogy because it's perfect. A tumor marker is just like the check engine light in your car. When that light pops on, you know something might be up, but it doesn't tell you what. Is it a loose gas cap? Do you need an oil change? Or is the engine about to blow? You have no idea. It's just a signal to pop the hood and investigate, not the diagnosis itself.
So if they're not for diagnosing people out of the blue, what are they actually good for? Well, their real power, where they really shine, is in monitoring. For someone who's already been diagnosed with cancer, these tests are incredibly useful for seeing if a treatment is working, for checking if the cancer has come back, and even for helping doctors get a sense of the prognosis.
Now, let's look at a few real-world examples to really see how this plays out. This is where that whole check engine light idea really starts to make sense.
Okay, take CEA. It's often linked with colorectal cancer, but just look at that other column. You want to know one of the most common reasons for CEA to be a little high? Smoking. Just smoking. Or it could be some inflammation or liver disease. It's so far from being specific to just cancer.
And this one, CA125. This is a fantastic example. It's associated with ovarian cancer, sure, but look at the list of benign causes. We're talking about totally normal things like menstruation and pregnancy, or common conditions like endometriosis. This right here is the perfect reason why we don't use it to screen everybody for ovarian cancer. It would cause so many false alarms.
And even PSA, a test that's specific to one organ, the prostate, is still not specific for cancer. A simple enlarged prostate, which is super common, or some inflammation, or heck, even just getting older, can all make your PSA levels go up. It's a clue about the prostate gland, not necessarily about prostate cancer.
So you're probably wondering, okay, if these markers are so vague, how in the world does a doctor make any sense of them? Well, it's all about having the right mindset and following a few key rules to avoid jumping to the wrong conclusion.
And here it is. This is the single most important rule of the game. One number, one snapshot in time, it means very, very little. What doctors are really looking for is the trend. Is that number staying flat? Is it going down? Or, and this is key, is it consistently and significantly rising over time?
And this visualizes it perfectly. A single CEA of 35? Yeah, it's a data point. It gets your attention, but it's totally incomplete. But a series of tests showing a steady climb from 35 to 50 to 90? Now that tells a story. A much more compelling and frankly concerning story that absolutely needs a closer look. The trend, that's the narrative.
Now, the reason for all this caution really boils down to two big ideas in medicine: sensitivity and specificity. And most of these markers have problems with both. They have limited sensitivity, which means a really early cancer might not even produce enough of the marker to show up on the test. And, as we've seen again and again, they have very limited specificity, meaning lots of other benign things can set them off and cause a false alarm.
So all of this really highlights the clinician's true job. It's not about knee-jerk reactions to a single lab value. It's about being a detective, gathering all sorts of different clues and pieces of evidence to build a complete and accurate picture of what's going on with a patient.
The tumor marker is just step one. It's the first clue. That clue then gets put together with the patient's story, their history, their symptoms. If there's still suspicion, that's when you bring in the imaging, things like CT scans. And the final, definitive, gold standard answer almost always comes from pathology, a biopsy, where a piece of tissue is actually looked at under a microscope. That's how you know for sure.
So let's just boil this all down to the main takeaway. Tumor markers are at their absolute best when they're used for monitoring a cancer we already know is there, to see if treatment is working or to check for recurrence. They are at their absolute worst and are basically being misused if they're used to screen otherwise healthy people or used as the one and only tool for a diagnosis.
So the next time you hear someone say tumor marker, I really hope you see it in a totally new light. It's not a verdict, it's not a judgment, it's just a signal. And the real story it's telling isn't necessarily about disease, it's a story that's simply saying, hey, it might be time to look a little closer.